Today we'll know about a backache. The backache is so common as common cold. It has been noted that at least a person will suffer once in his lifetime from this backache. The most common cause for a backache are lumbar strain, lumbar sprain, osteoporosis, disc disorders, spondylolysis, spondylolisthesis, spinal canal stenosis, and some other causes are there. As I said, the most common cause, that's up to 60 to 70% of backache, especially the lower back region. That's what we call as a loin region or a lumbar region. The cause is a sprain or a strain. Any injury to the muscle is called as a strain. That's an injury to the muscle. So the muscle fibers here gets elongated or get cut. It gets torn, resulting in giving a very bad low back ache. The next common cause is sprain. The sprain is injury to the ligament. It may get injured to the ankle, or that's what we call as ankle sprain, or to the low back region where the ligaments gets injured. So these are the two major causes for the low back ache. Whenever this happens, the main goal of the treatment is giving a rest to the low back region. The next common cause is disc disorders. So the lower part of the back, that's what we call as a lumbar region or a loin, where the maximum weight is fallen in this region. So it has got a bones. In between the bones we have a disc. This disc will come out and presses upon the nerve, giving rise to disc disorders, or we also call it as a sciatica. The next common cause for the backache is spinal canal stenosis. Here the spinal cord inside the spinal canal gets stenosed, means it gets caught. The diameter of the canal will be less and the spinal cord will be strangulated inside this canal, giving rise to the very bad backache. And here the patient cannot walk at all. Initially the patient will be walking for some distance. Later on this walking distance keeps on coming down. This is what we call it as neurological claudication. Other causes for the backache are spondylolysis and spondylolisthesis. Here in the spondylolysis, one of the back aspect of the bone, that's what we call it as a posterior aspect of the bone, or parts of the each backbone gets fractured, resulting in the this results in a backache. This is in case of spondylolysis, where there will be the break in the parts, where there will be a break in only the bone. If the broken bone moves over the lower bone, then this results in the condition called as a spondylolisthesis. Here the patient will have very bad backache, along with sometimes the pain which goes along the gluteal region, that's also called as a buttocks, then back aspect of the leg. The pain is more of a radiating type of pain which we get in this spondylolisthesis. So other quite less common causes of the backache are bone weakening, or also we call it as osteoporosis. Here the strength of each bone unit of the back itself is less. So this a lot of reasons are there for osteoporosis, but the most common is one is deficiency of the calcium, vitamin D, and minerals like phosphorus, magnesium, vitamin K. Another is senile osteoporosis. With the age, bone gets weakening. It's called as a senile osteoporosis. Another most common cause for a backache is facet joint arthritis. Facet joints, these are the smaller joints which are present in between the two bones of the back region. So these joints are very smaller joints, and any injury or wear and tear at this joint results in arthritis. This gives a very bad backache, especially the patient or a person will complain of a backache early morning. The patient will have a lot of early morning stiffness. So on movement, or if the patient does some exercises in early morning, the pain will get relieved. The pain on getting up the bed, later on decreasing, it's a classical thing of facet joint arthritis.